let me introduce our speaker today, today's speakers. Uh, Patne sir, President of Physician Association. Kindly come on dais, sir. Dr. Purva Bavikar, ma'am. Please, ma'am. Welcome, ma'am. Mr. Gaurav Nijon. Welcome, sir. Please. Dr. Shrikant Dhanwale, sir. Please come on dais, sir. And Dr. Suhas Bavikar, sir. Please, sir. Today's speaker, I think so all of you knows very well all the dignitaries. So please let me introduce them. Dr. Sanjay Patne, sir, President of Physician Association. I'm so sorry, one speaker left, Mrs. Ankita Garg, ma'am. Please come on dais, ma'am. Yes. Yes. Sanjay Patne, sir, President of Physician Association. Welcome, sir. Dr. Purva Bavikar, ma'am, Consultant Nephrologist. Mr. Gaurav Nijon, Health Fitness Coach. Dr. Shrikant Dhanwale, sir, Consultant Cardiologist. Dr. Suhas Bavikar, sir, Consultant Nephrologist, MIT Hospital. So I'll welcome all them in behalf of MIT Hospital and Suman Kidney Foundation. Thank you. We have one photograph, okay, please. Yes, yes.
हो यही सभी यहाँ पर थैंक यू सर
Thank you all dignitaries. Thank you. Please be seated. Thank you. Somnath, behalf of MIT Hospital and Suman Kidney Foundation, let me introduce about MIT Hospital in brief. MIT Hospital was set up in Chhatrapati Sambhaji Nagar with a noble mission to provide affordable, efficient and high level of healthcare services in this region. We are 100-bedded multi-specialty hospital providing all the specialties as well as super specialty services, having modern infrastructure geared with cater to all medical needs in the society as well as whole neighboring regions. We are situated near Kamgar Chowk and Fort Sidco. We have a team of highly qualified, dedicated and experienced paramedical team of professionals ready to serve the sick and ailing from all states of society. Some of our major specialties and services are kidney transplant and dialysis under nephrology department, angioplasty and bypass under cardiology department, angioplasty and bypass under cardiology and CVTS department, bone marrow transplant and bone marrow transplant and blood cancer patients under hematology department, all type of cancer surgeries, general medicine, ICU, joint replacements and ligament surgeries under orthopedic department, general medicine, ICU, interventional radiology, urology, general laparoscopic surgeries, neurosurgeries and gynecology. These are our departments. These are infrastructure and facilities we have. There are photographs of hospitals, mainly entrance, reception lobby. These are OT photographs, OT reception area, cardiac OTs and nephro OT. Then our cath lab department. Second, this is ICU and nephro department, dialysis unit we have. So these are the photo of dialysis patients. Nephrology department, MIT Hospital began with nephrology services in the form of dialysis in 2013. Later, with the guidance of renowned nephrologist Dr. Suhas Bavikar sir, we established a kidney transplant unit in 2020. So far, we have performed around 6,480 dialysis, 43 kidney transplant, 302 fistulas, 210 CAPD, 262 kidney biopsies. Then the cardiology department, we have the cardiac unit at MIT is operational 24/7, which is headed by Dr. Shrikant Dhanwale sir. Dr. Shrikant Dhanwale is one of the leading interventional cardiologists in the region. So far, we have performed around 2,000 interventional cardiac procedures, including coronary angiography and angioplasty. Right. We have cashless health schemes, more than 16 cashless companies we have tied up with them. So this is about all MIT Hospital. This CME is being held in honor of World Kidney Day, which is celebrated on 9th March. One of our distinguished feature in is the World Kidney Day celebration. MIT Hospital and Suman Kidney Foundation are organizing this CME. So I would like to thank you, Suman Kidney Foundation, for such wonderful initiative. Thank you all for contributing your valuable time and making this event more meaningful. Thank you all and welcome all once again. Thank you. I request Patne sir, please come on dais and start this lecture. Thank you. Yes.
Hello, good evening everybody. Thank you Suman Foundation, MIT Hospital and of course our own Physicians Association for arranging such a wonderful session today evening. We must all give a standing ovation. If not standing ovation, you should give 3 claps to our homegrown girl, Dr. Purva Bavikar, who is a nephrologist. She has done DM Nephro, and I get reports from Hyderabad that she is doing really well. She has presented papers which are very novel. The new method, or rather, if not new, the novel method which she published a paper on about some bursting sutures. I am a physician, so I know very less about it. But then I am very happy that somebody from our place is donning very laurels in South India. Thank you, Purva. So today I have been asked to talk on awareness detection and interventions for fitness goals. Though this is an offbeat topic for me, I ventured only because all are known to me. So what is NCD? NCD is non-communicable diseases, and it's a disease of lifestyle. Now, I was wondering whether we all know about it. I thought I knew much about it, but when I went through the figures, I was so much stunned to see that the global rate of obesity is around 45%. It's very high. Though I'm not a qualified person to speak on obesity, but these figures are really very staggering. See, and of this 45%, more than 18 years, 18 वर्षाच्या वर जवळजवळ 40% 40% people are obese. This is very scary. And below 18 years, about 18% are obese. They say that in the world, these are 2019 figures, about 463 million people are obese. And within the span of 20 years thereafter, they say that there will be a 51% increase, which will be 700 million. So you can just imagine that this is a pandemic. This is a huge pandemic that we'll be facing. The research study says that by 2030, every alternate patient would be obese. Every alternate person would be obese. That's really very, very scary. And how can we be behind? When the world is leading in obesity, we are all also leading. We have about 20% of the world's obese, 16% of the world's diabetics, and about 30% approximately of the hypertensives the world over. And as you all know, that obesity, in low exercise, sedentary lifestyle, these are the harbingers. These are the harbingers of all these diseases like cardiovascular, blood pressure, then sleep apnea, cholesterol, endometrial cancers. Breast and endometrial cancers, they have established a positive relationship between obesity and this disorder. Now, physical inactivity is a pandemic in our country, they say. The low cardiorespiratory fitness among the Indian population is a very major worry for us, because they say that It is an important risk factor over and above the smoking, diabetes, and obesity. So we don't work, we don't exert, most of the times we have a sedentary lifestyle. Sedentary in the sense that we spend less than 1.5 minutes of energy. एकाच ठिकाणी बसून राहणे. So when we are spending less than 1.5 minutes of energy, then if you spend more time like this, we develop a low cardiorespiratory fitness. And this is a very important risk factor, more risky than smoking, obesity, and diabetes. The mortality rate is likely to exceed more than 75% with this. So India ranks 5th among the Southeast Asian countries, and about 15% of physically inactive adults are in our country. And what is more dangerous, more sinister, of course, I'll tell you, that 73% of adolescents, inactive adolescents, are in our country. So physical inactivity, as you all very well know, it is a harbinger of so many diseases, heart diseases, failure, sarcopenia, cognitive dysfunction, breast cancers, non-alcoholic NASH, osteoarthritis is, of course, very common with this, and then insulin resistance and metabolic syndrome and all those things. So then question arises, what is physical fitness? Physical fitness is nothing but the ability to carry out daily work with vigor and alertness without getting undue fatigued, and with ample energy to enjoy leisure time pursuits and meet unforeseen emergencies. So the ability of your body system to work efficiently is fitness. Now being efficient means what? Being efficient means doing daily activities with the least possible effort, able to perform school work, meet home responsibilities, and still have enough energy to enjoy sport and other. Respond effectively to normal life situations such as stocking shells, and respond to emergency situations. So in short, physical fitness is nothing but the ability to meet all the ordinary demands of life without becoming tired and respond to extra demands when necessary. There are types of fitness. Again, health fitness, motor performance fitness. Of course, for us at our level, health fitness is what matters. This motor performance fitness is for sports person. And it has got different components, of which cardiorespiratory endurance, body composition. Somebody is going to speak on body composition. This is also very important. We tend to neglect it, but then this has a very important place in the armamentarium of physical fitness. The skills, this is required for sports person. Components, again, I just would revise: body composition, cardiovascular endurance, flexibility, strength, muscular endurance, and strength. Why body composition is important? Now, these are some few figures here. You can see this man on this side. This man on this side and this lady, both are obese. But then this man has got a truncal obesity or visceral obesity, what we call it. So he is metabolic unhealthy obese. Now this lady is also obese, but then she has less of this visceral fat, and so this is metabolically healthy obese. Nowadays they speak of metabolic health, metabolic fitness, wherein there are certain parameters. They say that they should be normal, then you are metabolically fit. So how can you find out metabolic fitness? See, measuring body fat is something very difficult, but then you can get an idea with this, with waist circumference, then waist height ratio, and of course this BMI criteria that we have. The body composition can be measured. Somebody is going to talk, so I would skip this. Body composition is measured by this DEXA scan, body impedance, bioelectrical impedance analysis, and skin calipers. Both are very tedious and costly, whereas skin calipers is something very easily can be done. Cardiovascular endurance, this is by cardiopulmonary exercise testing. It is by testing the amount of oxygen that can be utilized while doing exercise. The ability of the cardiovascular and respiratory system to supply oxygen during sustained physical activity. That will test about the VO2. That is the fixed principle. So, and then VO2 again depends on these parameters. on inspired ventilation, the air, then it goes through the lungs to the pulmonary circuit, pulmonary circuit. From the pulmonary circuit, it goes to the muscles for consumption. Then in the muscles, in the mitochondria, it generates ATP, which is the energy currency of the body. Now, there can be problems with any of these stages here. Medical benefits of exercise are, everybody knows, they prevent cardiovascular disease, there is a means of calorie expenditure and improve the work efficiency. Flexibility again is very important. Flexibility is movement around joints, and it's very important that will prevent sports injuries. The capacity to exert force against resistance in one maximal effort is called as, they said that hand grip was more powerful predictor of cardiovascular mortality than blood pressure. They also found that grip strength is to be associated with all-cause mortality, myocardial infarction and stroke. So just by measuring the grip strength, there are scientific ways where you can measure the grip strength, and that will give you an idea whether this patient has less strength. Muscular fitness, again, these are the various components: stretching, strength training, and they have shown that with strength training, there are reduced sports injuries to less than 1/3 and overuse injuries by almost half. Muscular strength and endurance are the components of muscular fitness. So nowadays they stress more on muscle-centric approach. These are the middle CT scan. You can see this is a quadricep of a 70-year male patient. You can see the amount of adipose tissue. The white thing is adipose tissue. And just below is a 70-year male who exercises regularly. You can see the adipose tissue is very less. So that's the importance of muscle training. Components of motor performance, this is very important for sports person. For us, we just concentrate on fitness. Then dose response, how much exercise to be done, what duration and frequency. Again, this is, but we must know the health benefits associated with physical activity. We know that it reduces BP, it reduces the risk of CHD, then it increases the immunity, then it controls body fat gains and reduces chances of osteoporosis. The risk of cancer, this is again very conclusively proved by certain studies that breast cancer and endometrial cancers are reduced in non-obese people. Cognitive function also improves, the depression goes down, osteoarthritis chances reduce, and mortality of course is on the lower side. There are also social gradients to fitness, of which everybody knows. I don't think we should concentrate more on this. Fitness training concepts again include specificity, progressive overload, recovery time, intensity, and duration of treatment. This is a duration of exercise session. This is for sports person. The various concepts in are interval training, anaerobic exercises, and strength training. These are informal methods of measuring fitness, but there are very knowledgeable person than me who will talk to her, so I'm skipping it. But there is a caveat. You must know when not to do some certain silly things. You cannot go on exercising without understanding the basics. For example, now somebody has had COVID and now he's cured of COVID. So when should he start exercise? That is also very important. COVID recovery, return to play, you always have to employ the stop and reassess every 24 hours, provided he has had a severe COVID. Then restrain intense exercise for at least 2 weeks. These are the guidelines that have been issued by the sports medicine. Then routine pre-participation, physical medical evaluation, exam evaluation is a must. Symptomatic COVID with no pneumonia and myocarditis, no sports or exercise for 2 to 4 weeks. 4 आठवडे म्हणजे 1 महिना त्यांनी exercise करायचीच नाही. That is a dictum. Somebody who is symptomatic and had pneumonia, he should not do any exercise for 4 weeks, for 1 month. Somebody with myocarditis, who had myocarditis, it is for 6 months. Now I'll tell you, to diagnose myocarditis clinically is difficult. Even echo does not diagnose myocarditis. What you need is a cardiac MRI, which nobody does. So if somebody has COVID, it's always better that you defer exercise for a pretty long time, because there's a chance that if he had had myocarditis with COVID and he exercises, he may land up with some problem. Recovered with no signs symptoms for at least 7 to 10 days may return to play with minimal exertion for 2 weeks, reaching pre-COVID activity after 4 to 5 weeks. So, well, friends, thank you for giving me this opportunity. I tried to skip most of the things. Now, may I invite the next speaker, Purva Madam, our own Purva Madam.
Good evening, everyone. I'm grateful and delighted to speak in front of you all. It is a great initiative by Mighty Hospital and Suman Kidney Foundation to celebrate World Kidney Day by promoting fitness for all. Today, I shall be discussing the physiological interventions of diet and exercise to protect kidneys. I don't think such an elite crowd needs to understand or needs to be told about the importance of exercise, but nonetheless, I shall just focus on what exercise does for our kidneys. So, since nutrition will be taken care of in the next slide, next speaker's talk, I shall just focus on diet on one slide. So, many guidelines recommend high diets that are high in fruits and vegetables and low in animal protein because they are associated with lower endogenous acid load. This in turn will reduce the workload of an individual nephron, which will in turn protect our kidneys. So this is applicable for all individuals who are not having kidney disease or who are having kidney disease, both. Moving on, we all know that exercise has a positive impact on several organ systems like heart, lungs, brain, liver, musculoskeletal system. And many guidelines recommend that exercise for more than 150 minutes, but less than 2000 minutes per week, that is aerobic as well as strength training, can have longer effects of exercise as all these systems. Basically, there is reduction in sarcopenia, there is increased glucose in uptake, muscle endurance is also increased. The VO2 max, as explained by Dr. Patni sir, increases with exercise. There is decreased inflammation, depression. The cardiovascular capacities also increase with chronic physical activity. And of course, there is reduction in insulin secretion and increase in glucagon secretion. So what about kidneys? Well, kidneys play a very silent role when we are exercising, basically because they do not take up the increased demand of oxygen supply, or they do not even occupy any extra energy while a person is exercising. So what happens to the kidneys as physiologically when an individual is exercising? There is a relative decrease in renal blood flow. Around 25% renal blood flow is reduced while exercising because the blood is diverted to musculoskeletal system, which requires energy production. Then there is effective reduction in renal plasma flow, but the reduction is not as much, so the effective glomerular filtration rate remains to be stable and it is not altered. The other physiological effect that exercise has on the kidneys is there is transient mixed proteinuria. So in case there's somebody who has exercised, any form of exercise, maybe mild or strenuous, they can have transient proteinuria, which lasts for about 1 to 1.5 hours post-exercise. So we should avoid sampling during this period. Lastly, the effect of exercise on kidneys is kidneys basically have an acid-base balance and fluid balance function while exercising. So what happens is, on the left hand, where the screen is yellow, what we can see is there is increase in intensity of exercise from rest to 25% to 50%, 75% and 100%. So what we can see is that there is a decline in pH physiologically from 7.42 to 7. So to compensate for this metabolic acidosis, the kidneys take in and have to produce bicarb. That is, the spent bicarb is around 18 with 100% of intensity of exercise. So they have to produce 6 ions of bicarb to balance and bring back the transient metabolic acidosis to normal pH levels. Another thing that the kidneys have to do while exercising is that, as we can see, during rest, we produce around 1400 ml of urine. But when an individual is exercising, it has an antidiuretic effect. So around 500 ml of urine will only be produced. Other thing is that it is important that while exercising, other fluid losses are conserved through lungs, stools and sweating. So we can see maximum amount of fluids is lost during sweating, that is around 4 liters. So it is very important to stay hydrated while exercising. Now coming to patients who have kidney disease, what happens to them, and is exercise advisable for patients with kidney disease? So the issue with kidney disease patients is they have a reduced exercise intolerance. Exercise intolerance is basically reduced performance of the heart in order to balance or the requirements of any strenuous activity. So for instance, if a CKD patient is asked to do 5 squats or is asked to walk 10 meters, they'll get breathless. So that is called exercise intolerance. Now, exercise intolerance in kidney disease patients is directly correlated with the kidney function. Now, because of kidney disease, there will be uremia, there will be metabolic acidosis. This in turn will cause sarcopenia, there will be fluid retention, respiratory muscle wasting, there is increased sympathetic activity, increased renal nerve afferent activity, and because of that, there will be increased left ventricular hypertrophy, and myocardial stunting will also be there. Along with that, systolic and diastolic dysfunction can be seen. So how do we overcome that? Basically, kidney disease patients should not be told that you cannot exercise. In fact, the motto of every physician or every nephrologist should be that we should increase the quality of life of the patient. So in order to do that, exercise is the best and cheapest prescription that one can give for their patients. Now, what are the issues that can happen while you prescribe an exercise regimen to a kidney disease patient? There are personal barriers and then there are personal enablers. So, personal barriers for a CKD patient are they're usually fatigued, or if they exercise, they cannot recover quickly to active state. They have a fear, they have mobility issues, then there is a lack of drive to go for exercising, and then there's frustration and disappointment and helplessness. So in order to overcome these barriers, it is the doctors, their family and friends who should enable them through various activities. One such example of enabling a kidney disease patient to exercise is tomorrow's event, where we are involving kidney disease patients who are participating in 10 kilometer, 5 kilometer and 2 kilometer cycle races. So this is a fantastic initiative through which kidney disease patients feel inclusive, which is a very common term that is being used these days. So including them in normal day-to-day activities is also enabling them for a good quality of life. Lastly, when should we prescribe exercises for acute kidney injury patients following discharge? We need to remember that acute kidney injury patients are the patients which will progress to chronic kidney disease. And there's a very narrow window to prevent that. So AKI, after AKI, there is a period between more than 7 days but less than 90 days, which is called acute kidney disease, in which exercise can prevent AKI patients to go into CKD. So, but while prescribing exercises to them, we need to keep in mind the patient's age, the multiple morbidities they may have, the type of exercise which we need to prescribe. For example, somebody who has recovered and who was intubated and has got extubated with an AKI cannot be asked to run 5 kilometers a day immediately post discharge. So there should be a gradual increase in exercise regimens. And of course, we need to keep in mind the baseline cardiac function. And when should exercise be prescribed for AKI patients is immediately after discharge. Of course, with what I just mentioned, they should gradually and slowly, keeping in mind the physiological vital parameters, keep on increasing their exercise schedules. Last word about azelnidipine, that is Zeblong 8 mg. It's a calcium channel blocker, and we very commonly used in CKD patients with resistant hypertension. It is a dihydropyridine type of calcium channel blocker, and it is a third generation. It is available in 8 mg and 16 mg. The maximum dose that is being tried on is 32 mg, but the safest zone is 16 milligrams. It can be given twice daily, and it is an excellent drug to reduce hypertension. So, thank you all, and I wish you and welcome you for World Kidney Day.
Thank you, Purva Madam, for such a masterly presentation on a topic which is really not only difficult but to comprehend, but also very difficult to practice. Now, can I ask you one question, Madam? You said AKI patient 7 days to 30 days is the time, 90 days, sorry, 3 mahine. So 7 days to 90 for 3 months, he should not exercise. He should exercise. Okay, please clarify on this.
So what I mean by initiating exercise for patients is, for AKI patients is, for example, if we have an AKI which is improving and which has been planned for discharge. For instance, say the creatinine was 3 on admission or 5 on admission, whatever treatment was received for the patient, and the patient's AKI recovers. So AKI recovers meaning the renal function comes down to 0.8 or 1 creatinine, or he is passing around 2 to 3 liters of urine per day. In this scenario, what happens is, if when they go home, their diet changes, their hydration status changes, their attitude towards the disease changes. So they are again at risk of chronic kidney injury, which can continuously, there are multiple hits to the kidneys, which can occur over a period of 90 days. And if a patient, if you've discharged them at creatinine of 1 or 0.8 or 0.9, 1.22, that patient after 3 months may come back with the same creatinine, or their creatinine may be elevated. So one of the prescription that helps AKI patients is exercise. Now, what form of exercise, the next speaker will let you know about. But kidney disease patients not to exercise is not the caveat anymore. You should promote exercise in them, both AKI as well as CKD. But of course, AKI who are recovering.
Thank you, Purva Madam. Now our next speaker is Mr. Gaurav, who is a strength and conditioning coach, and he's going to talk on effect of load variation on jump height. Now, friends, I'll tell you, these are very difficult topics. There's a lot of work going on in sports medicine on these topics, and I'm really glad that there's somebody who speaks on this.
Thank you so much, Doctor, for introducing me. And thank you, Dr. Bavikar, for actually giving me the opportunity to speak about a very niche profession, which is called strength and conditioning. Till now, I feel, a lot of times we feel that we know that we have to exercise, but we don't know where to go and how much to exercise. So that is why strength and conditioning coaches come into the picture, wherein we can guide you how much to exercise, when to exercise, and what is the right dosage for exercise. So here I am. My name is Gaurav Nijon. I'm the founder of Nijon Training Systems. Basically, Nijon Training Systems is a system that is evidence based, and we can also now implement these systems not only in a athletic setting but also in a healthcare setting. So today, more than talking about the science of strength and conditioning or sports science, what I really wanted to take you through is introduce my profession, and then we can take it forward from there. Great. I think for the lot of time, one perception that comes to our mind when we think about strength and conditioning, or we think about strength training, we always have this picture of a bodybuilder, right? So whenever we go to a gym, the first thing we think that the guy who's got magnificent muscles is the right person, or is the go-to person, right, who can make us exercise. But here we are, you know. Uh, so who exactly is a strength and conditioning coach? So we are basically exercise science professional. We go through a strenuous 3 years course from bachelor's of sports science to then masters in sports science. And usually at this point in time in our country, what we've done is we usually work with most of the athletes, but we are also now trying to extend our scope of practice from athletes to now actually working with healthcare or general population as well. Right? So how do we actually improve performance, right, for athletes or probably for general population, right? So we basically understand a few parameters. One of them is, just by checking blood, we do blood lactate analysis, we do biomechanical analysis. So we basically are going to see what exactly and how much is the joint, how much is the range of motion a joint is going through, right? We also do VO2 max testing, wherein we can now know what is the highest amount of oxygen consumption that you need to play a particular sport. Thereafter, I think, how do we design a program? Often, when we talk about strength and conditioning or we talk about exercise, we go to the gym. We basically have no clue where to start. Just like how in every sport we have we do a needs analysis. So that needs analysis basically involve, first of all, we check that if you're a tennis player, this is a needs analysis of a tennis player. So we basically know now that a tennis point doesn't last for more than 10 seconds, right? Distances covered in tennis are 2.3 kilometer for male and 1.6 kilometer for a female athlete during the entire match. Aerobic capacity of minimum of 50 ml per kg per oxygen is required if you want to play at the highest level. And a typical three-setter, if we eventually don't see a lot of three-setters over on the television, we usually see the five-setters. But while going through the development process, an athlete plays for around hour and a half, out of which the playing time is just 18% of it, which is maximum 30 minutes, right? Now, coming back to how can we relate this to our general population, to all of us, right? It is very, very important that I think a lot of earlier speakers have covered the science of it, right? But why it is important that we need to analyze what is our needs personally. So our needs as a general population is that we have to be fit. Now there are a lot of different definitions of being fit. One of the definition earlier actually he gave, Dr. Patne said that it is extremely important that you can do your daily functions without any pain. Just imagine the fact that you have to actually climb 10 steps and you're huffing and puffing, right? So we definitely know that the direction now we are going towards there is some kind of an issue and we need to now solve that problem. Before we can actually get into, how can we improve performance? These are some of the basic mechanical concepts that we study, or basically we inculcate in our daily practice. If you see, force is nothing but mass into acceleration, and power, I know that's a little bit, high level stuff, but power is nothing but the rate of doing work, of how fast we can do a certain, work as soon as possible. So that maybe, probably if you want to just get off the chair, you're able to get off the chair very easily. But if you see over the point of time when we, hit the age of 45 or 50, it is very difficult to perform just an activity which is as simple as getting off the chair or maybe squatting 5 to 10 times as fast as possible, right? So why is it that we are not, why do you think that, we can't do that, right? So because we are not training for one quality, which is very, very important, which is called power, right? So we usually go to the gym, we lift heavy weights, but we never train for power, right? So again, there is a concept in sports science which is called the force velocity curve. So we basically take the athletes to the entire force and velocity spectrum, if you can see in the graph. And then we segregate the athlete into, probably if the athlete is in the higher side of y-axis, if you can see, that athlete is more force dominant. And if the athlete is, on the lower side of the x-axis, the athlete can produce more velocity but lesser force. So these two different athletes, or probably these two different individuals, even for general population, if we can take them through the entire force velocity testing, we can exactly know that how much of weight do we have to prescribe, so that's the load that you really have to train in. Instead of just going to the gym and randomly lifting maybe 10 kilo, 12 kilo or 15 kilo, we've got no idea in which direction we are moving towards in. This is one of the study that we did, when I was in the university, checking the effective load variation of jump height in adult male tennis players. So what we asked them, we recruited different individuals and we asked them to do jumps on a force plate with basically just body weight, and then a 20 kilo barbell, then a 30 kilo barbell, and of course the last one was a little on the heavier side, if you can see down, with a 40 kilo barbell. And of course we noticed that as and when the load increased, right, it's pretty obvious that the jump height would reduce. But why are we even checking this? Because probably there are two individuals, just like, general population, or, just like me and you, who would actually jump the same, but the rate at which we are producing forces might be totally different, right? So if you see, right over here, we've got an equipment which is called the force plate. We can now ask the athlete to jump on the force plate, or rather, we can ask any of you guys to jump on the force plate. Actually, we've got the equipment, we are making it available tomorrow. And then we can exactly know the amount of force that you have produced, how much time you took to produce peak force, and how much was the rate of force development. And now, accordingly, instead of guesswork, we've got some data, and now we know that there are certain parameters that we have to train, so that for the entire longevity of our health over the period of time. All right. So again, as I said earlier, that strength diminishes at 10% at the age of 50. But if you see, after the age of 40, power diminishes by 51%. So guys, have you ever imagined, when probably you were 30, you were able to sprint, but today if you are 50, 55 or 60, you are unable to jump, sprint, or probably even cycle fast, right? Like the way you used to do when you were young. That's because we've never trained for power, right? So what can we do in everyday life, right, to make sure that we're training for power? We can basically, just get off the chair probably a little faster, we can squat a little faster, we can take lighter weights, work a little bit on our jumping activity, and challenge our footwork, right? Basically, just do a lot of coordination work because eventually we see a lot of balance issues happening in elderly people. So if we do all of these stuffs, probably functionally we will be there, and we might not have any sort of injury, and we'll be able to do our functional everyday life work smoothly. I think this is one of the videos. This is my mother who's been training with me for almost 6 months now. And if you see, I'm doing nothing but just taking her through, as Dr. Patne said, through the entire spectrum of progressive overload, right? So first he started with basic weights, gradually moving forward. If you can see in the video, we are also doing, with a little heavier weight. And this is power. Basically, I am just taking her through how fast can you actually move a lighter object, so that we are now working on power. If you see, these are nothing, basic things that you can do so that you can work on power, right? And not, so the ability of, to produce force, of course, you've got it, but you also have to train for power so that now you can do, a specific thing as fast as possible. Going forward in the future, our aim is to, if we can, bridge the gap between sports and patient care. That how can we open a facility wherein we can do, multiple, uh, procedures, interventional procedures. But at the same time, we should also include, sports as an intervention wherein they are not, after probably a surgery, after a few weeks with the guidance of healthcare professionals, we can help them to play a specific sport, take them through the entire spectrum of strength and conditioning, evidence-based practice, and we can, eventually, increase their quality of life. Right? Thank you so much, guys. Thank you.
Thank you, Gaurav sir, for such a informative talk. And I just wish that our city of Sambhajinagar also has this facility in near future. And very knowledgeable people in this field who would guide us. We all know some things in bits and bits, but this is a scientific way of knowing things. Mind you, friends, interventional clinical physiology is a very, very important branch, and a lot of work is being done. Uh, a lot of work is being done in India. I would just like to know from Gaurav sir, do we assess, means do you have any certain parameters to assess with a person below 50, above 50, and our exercise protocols post-COVID?
Sure. I think there we don't yet have enough research in terms of exercise or strength and conditioning post-COVID. That is where the healthcare practitioner comes into the play. But in terms of assessment for people over 50, one of the major assessment that we do is the talk test. If probably we just ask you to walk at different speeds, so let's say you start from 6 kilometers per hour on a treadmill, you go to 8 and you go to 10. If you can't continue that activity for more than 5 minutes without having a normal talk, then that's the time we know that we need to stop and eventually increase the threshold. That, I hope that answers my question. Sure.
Thank you, Gaurav sir. Now we have next speaker, our own homegrown cardiologist, Shrikant Dhanwale, who is going to talk on heart protection physiology through exercise. Dr. Shrikant Dhanwale, sir. He is student, his father was student of GMC Aurangabad, I believe. And now he's there, he's an interventional cardiologist at MIT Hospital, and he's going to talk on heart protection physiology through exercise.
Good evening, everyone. Myself, Dr. Shrikant Dhanwale, interventional cardiologist at MIT Hospital, Aurangabad. Today, we will be discussing about heart protection physiology through exercise. Actually, Hello. Actually, earlier speakers have already covered 90% of my slides, so I will just fast forward my slides. So, a basic function of the cardiovascular system, we know that heart actually which pumps the blood to the blood vessels. It the blood transports nutrients, hormones. It helps in development of the immunity. And these are all basic things. So basically, the normal heart rate is 60 to 100 beats per minute, and we all know that this cardiac output is a function of heart rate plus into stroke volume. So heart pumps at least 5 liters of blood per minute. So what is the importance of exercise? So basically, what is exercise? Exercise is a body activity that enhances or maintains physical fitness. It is performed for various reasons like to aid growth, improve strength, develop muscles, for athletic skills, weight loss or maintenance, improve health, or simply for enjoyment. So we'll see further. So this is important. So as I'm a cardiologist, so I will talk more regarding this heart-related exercises. So according to American College of Cardiology guidelines, ACC guidelines, which recommends that per week at least 150 minutes of the moderate intensity aerobic exercises or 75 minutes of the high intensity aerobic exercises are recommended for at least 5 days of the week, and ideally they should be spread throughout the week. So this is important for the what is the stock evidence behind this, because the habitual this moderate intensity exercise is said to be very much beneficial for preventing the coronary artery disease. So fatal and non-fatal CV events are prevented by these habitual exercises. So habitual word is very important. So these are the sources for if anyone wants for the exercise. These are the online you can get from National Institute of Health or American Heart Association or American College of Sports Medicines, John Hopkins. So how exercise helps the heart? So exercise got many positive effects on heart health, like it lowers blood pressure, lessens risk of developing type 2 diabetes mellitus. It reduces your body weight. This is very important. Fourth point, this reduces inflammation throughout the body. So currently we do in our clinical practice marker known as a high sensitive C-reactive protein, which is a marker of the inflammation. So basically exercise helps in reducing it. It overall reduces the stress hormones. It helps in reducing the depression as well as helps in reducing the dementia. It basically works like a beta blocker to slow your heart rate and slow your blood pressure. It increases the good cholesterol, that is HDL. It increases HDL. So this is already I have discussed. The ACC recommends that daily at least 30 minutes of the moderate intensity aerobic exercise. Aerobic means the exercise which utilizes the oxygen. So 30 minutes of the exercise daily for at least 5 days per week is essential. And it should be added with the at least 2 days of the moderate intensity weight or strength training to get the total benefit. So how do we know that you are making progress in exercise? So first time you exercise, your heart rate increases. But over a period of time, if you exercise and your heart rate it remains constant, so that is a sign that you are making progress. Your heart is getting fit or it is developing preconditioning. So when knowing when you are overdoing it, the important signs of the overwork is fatigue and the soreness. Everyone knows that after doing exercise, if next day we get soreness or the persistent pain, it means if you have done exercise properly but you have overused your muscle. So that is a sign you have to stop overdoing the exercise. So this is the basic physiology. What happens after exercise on the cardiovascular system? So on the blood, as we exercise, there is development of mild hypoxia. It stimulates the juxtaglobal apparatus. It results in the production of the erythropoietin. This increases the production of the RBCs, and this decreases the pH. acutely. But chronically this is beneficial because it helps in maintaining your fitness. Second, on blood volume, the heat is produced and that causes activation of the thermoregulatory system, and that causes fluid loss, reduced volume and hemo concentration. Why I am telling these things is, currently you are seeing lot of patients having deaths while doing gym or exercise. So acutely, if you are unaccustomed with any exercises and if you do a high intensity exercise acutely over a short period of time, that is over a span of the 5 minutes, so these changes can be detrimental for the patient. So in predisposed individuals, these changes can lead to the development of the acute coronary event, that is acute heart attack. So this is on heart rate. So we all know that during exercise our heart rate increases, but as you get accustomed to it, your heart rate remains steady. Or even the marathon runners, their heart rate is low because of the increased vagal tone. This is very important point. What is effect of exercise on the venous return? So we all know that majority of the sudden cardiac deaths occur immediately after exercise. Why do they occur immediately after exercise? Because during exercising, the venous return is increased, and this is because of the mainly pumping action of the calf muscles. So if you are exercising and if you stop suddenly, this venous return decreases abruptly. So already the demand is more, and oxygen demand is more, and there is hypoxia in simple words. And so if the venous return decreases, so it produces acute shortage of or acute ischemia to the coronary arteries. So in predisposed individuals, especially the asymptomatic individuals who are having acute coronary artery disease, they are predisposed to the acute myocardial infarction and SCD, that is sudden cardiac deaths. So we have to, while exercising, we have to, there is known as warm up and warm down. So at the start we have to warm up, at the end we have to warm down. This has to be done in a slower basis. This is one important point. What happens to the blood flow to the skeletal muscles? There is great, during exercise there is an increase in the amount of the blood flow that flows to the skeletal muscles. So it increases from 3 to 4 ml to the 60 to 80 milliliter in moderate exercise, or 90 to 120 ml in severe exercise. What is important is, there is a now term known as the remote ischemic preconditioning. So by the remote ischemic preconditioning, actually there are new trials which are showing that you can actually decrease the infarct size when the patient gets heart attack. So the thing is that we have to inflate BP apparatus, BP cuff in the arm for the 2 to 3 minutes, and it produces ischemia of the skeletal muscles. But because of this, some hormones are released and they actually help in the reduction of the insult to the myocardium when the patient actually gets heart attack. So it is being utilized, one of the mechanism. So effect on the blood pressure. So these are two important concepts. What is isotonic exercise and what are isometric exercise? So which one is beneficial? Isometric means, isometer means where the length remains unchanged. The examples of isometric exercise, everybody is currently knowing that on the videos that planks are being done. So planks is said to be isometric exercise. And isotonic means where the length changes, like push-ups, then squats. These are isotonic exercises. So which one is beneficial for the heart? Isotonic exercises are said to be beneficial for the heart because they cause not only increase in the heart rate, but they also cause increase in the myocardial contractility. So it increases the systolic blood pressure. On the other hand, these isometric exercises, they are for the building strength, not effectively, but they result in the reduction of the blood pressure and reduction in the myocardial contractility. Now this blood pressure of exercise. So what is important in this from practical point is, acutely if you do unaccustomed level of exercises, it causes acute rise in the blood pressure. So in predisposed individual, this can sorry uh, this can cause acute coronary events. So we have to slowly and over a period of time do the exercise and build up like this. So these points we have already discussed. The benefits of cardiorespiratory exercise are we have a stronger heart and lower resting heart rate, then increasing aerobic capacity, maintenance of body weight, body percentage, management of stress. So dementia is decrease, your bone strength is increased. Basically, there is a absolute reduction in the CV events over a period of time. This is the absolute benefit of the exercise. Thank you.
Thank you, Shrikant sir, for such a excellent presentation on exercise and heart. Now, I invite our next star speaker, Dr. Suhas Bavikar, who is probably the first nephrologist from our city, and he's been practicing for past 32 years, if I'm not wrong. And he has pioneered so many things in Aurangabad. Aurangabad was a small place some 30 years back, but in those days I still remember him to be in great demand for putting in central catheters. That was also a very, very novelty in this city because it was a small place. So he has pioneered many things. Now he is going to talk on role of immune system function tests in kidney protection.
Thank you, partner sir. At the outset, I would like to thank each one of you for sparing this Saturday evening with us. I am talking to you on immune system and kidney diseases. I'll give you some analogies and beg your excuse for in case I hurt anybody. The two concepts I would like you to take home are one from cricketing analogy and the other from political system. From cricketing analogy, I would like you to remember three players. One is Sachin Tendulkar, second is Chris Gale, and third is Kieron Pollard. So the point I want to drive home is all clinicians who are dealing with kidney diseases should learn to understand the artistic batsmanship of Sachin Tendulkar and not learn hard-hitting power batting of Chris Gale. The simile I am giving you is to drive home that each kidney disease has its own treatment. Diabetes has its treatment, hypertension has its treatment. But if you study a patient's immune system and then use that for the patient's benefit, just like Sachin Tendulkar, you must be remembering the famous shot of Sachin Tendulkar over slips to Shoaib Akhtar in the World Cup final, where he understood the speed and direction of the ball and guided the ball with uppercut over the head of the slips for 6 runs. So not hitting the ball and guiding the ball is the artistic approach of a batsman. So similarly, all doctors should use patient's immune system to guide the treatment and understanding immune age of the person, young system or old system, whether person is immune competent, immunosuppressed, immune activated, immune paralyzed, immune deficient. All these situations, statuses will have different patients will have different statuses. Just like each ball is different and the batsman has to understand the ball before he hits. So understanding immune system by doctors who are treating kidney patients is very essential to become skilled managers. And then second point I would like to take you home is the relationship between immune system and kidney disease. the immune system and renal system are like two political parties. Congress, BJP, Shiv Sena, just political parties. So when they are in power, they are very friendly to each other. Just like immune system and kidney disease, when you are healthy, they are helping each other. But when they are in opposition, they are fighting, then they will make each other's life miserable. So in kidney diseases, I would like you to classify them into three groups. One is the disease with disordered immune regulation causing kidney disease. So these are IgG disease, good pasture syndrome, you know, anti-GBM antibody, IgA glomerulopathy, you know, antibody, IgA is responsible for that, complementary disorders, immune cells causing crescentic GN. These disorders are disordered immune regulation system causing kidney disease. Then the second group is CKD is happening because of other diseases like diabetes, hypertension, obesity. But immune system is adding to the speed with which these diseases progress. So the inflammation added by immune system activation will kill the kidney faster and person will reach end stage faster. And the third group is CKD and immune system are friendly to each other. They are not affecting each other. So if you understand before starting treatment with kidney disease, whether the immune system and kidney are friends or enemies of each other, then you will do much better. That can be done by doing a biopsy or biomarkers or urine test, blood test. There are many things which we can do. I'm not going to speak on that. So we will just, I'll just give you some words from politics for each of these slides. Overview of innate immune system. Just imagine a political party. It has got two wings. One is the party per se, and the other is the leaders in power. So innate immune system and adaptive immune system are the two parts of an immune system. Innate immune system is like, say, BJP, just giving an example. So BJP as a party, there are 14 players in innate immune system, there are 14 cells. So similarly, there are many members of BJP party. And adaptive immune system is those who are in power. So chief minister or prime minister or ministers, cabinet ministers. So there are 7 players in adaptive immune system: T cell, B cell, T helper, T killer, and plasma cells and B cells. So these cells and of party players and the people in power, they are playing a game called Taki. You may remember a song, Taki O Taki, Taki Re Taki Re. That was in Himmatwala. So Taki is a word to remember for T is tolerance, A is apoptosis, K is killing, and I is inflammation. So all these players in both the party and in power, they are playing this game of killing and inflaming, means killing the opponents or the cells which are foreign to you. And sometimes if the disease happens, they will kill the cells also. So this is the picture of the players in the immune system and in the political party like. These are the numbers of the cells which are there in your blood. So similarly, we have political posts, we can classify them as mediators. So mediator, political activator, then the leader, and then the शतरंजी उठाने वाला, ऐसे काफ़ी लोग रहते हैं political party में. So we will focus on 2 people. One is a mediator, like say Sanjay Rauts or Pramod Mahajans or Jairam Rameshes of today's era. These are the key persons kind of bridging the innate immune system and adaptive immune system, and then deciding whether the adaptive immune system kills or inflames or tolerates. So that is how the political parties work. antigen presenting cells, T helper cells or dendritic cells, these are the intelligence bureau of each party. They will find out which party worker is working against the party, which party worker is genuinely working for the party. Likewise, they will feed the information to the proper persons and then elicit a response of the leader or the boss who can generate inflammation or kill the person who is not desired. So phagocytosis is the word used in immune system, immunology, where you eat a small, bigger party will eat a smaller party. So phagocytosis is the word, and there are different receptors on these phagocytes. So there are some undergraduate killers and there are some postgraduate killers in immune system. Similarly, in political system, there are killing means not giving a ticket to a political activist, is killing his political life. So similarly, killing self cells or killing the foreign cells is mediated through receptors. Receptors are the informers of the political system. Opsonins are another flags or party symbols or loyalties of the person or the player. So these are the terms in immunology, toll-like receptors and PAMs and DAMs. We are not going to go into details of these. Toll-like receptors, PAMs, pattern recognizing receptors. There are different ligands, toll-like receptor signaling, then rig-like receptors. These are all methods of creating communication between different party workers. So inflammation in political language is, Shiv Sena language is Rada. So Rada means fight between the two parties. If that happens in the kidney, then kidney fails or CKD happens. So inflammation So this is the intelligence bureau or of the immune system, and this is the key cell or key person in political life. Is, say, Amit Shah of today's era, dendritic cell. So I'll stop here and would like to thank you again, all of you, for sparing your precious evening with us. Thank you.
Thank you, sir, for making such a difficult topic so lucid. I have a small question for you, sir. Can you tell us is there any way to know that whether the immune system is working in unison with the kidneys or it's going against the kidneys? Is there any marker for it?
See, if someone's creatinine is normal, urine is normal, his GFR is 100 plus, then the kidney is said to be healthy, then immune system and kidneys are working in same party. So they are helping each other and not causing any disease, not allowing any factor to injure and fail the kidney disease. It will not allow kidney disease to develop if your immune system is working with your kidney.
I think that explains most of the things. Now, last speaker is Mrs. Ankita Ghag. She's going to speak on the role of body composition analysis. This is also very important, very practical for us all practicing physicians, because the concept I told you about metabolic fitness. Metabolic fitness is the term that is given so much of importance in ICP, that is Interventional Clinical Physiology. Mrs. Ankita Ghag, please.
Thank you, sir, for kind introduction. Thank you, sir, for having me here and giving me this opportunity. So hello everyone, I am clinical dietitian. Being a dietitian, everyone will be expecting me to talk on diet, but today I'm going to talk about the basic thing about the diet which we all dietitians follow and everyone does, I believe, is the assessment, and assessment through body composition analysis. And why it is necessary is this. People are going towards the health as well as towards the disorders. And what is the difference is the food that they eat. And how are we going to assess it? It is basically with the help of body composition analysis. As sir correctly said, the body composition analysis play a key role. It is divided into 4 compartmental model and 2 compartmental model, which we call it as a fat mass and fat-free mass. And it is done in a non-invasive way. As there are DEXA scans, BIA technology, skin fold calipers, there are various more techniques which are available these days wherein we can do this body composition analysis. What is it exactly? It's nothing but a simplified version of your body. And what are they going to help us with? If we are talking about any diseases, what body composition is going to help us for? First, it will tell us about the sarcopenia status. It will tell us about the fluid balance of the individuals. It will tell us about the intramuscular fat. It will tell us about the nutritional status or cellular health. Sarcopenia status. It's very essential to understand if anyone is going into sarcopenia and how are we going to assess it. It's basically, as everyone rightly said, it's more of a summing up which I am going to do. You can call it as a power, you can call it as a strength, you can also call it as a muscle index. But how are we going to classify that individual that this person requires a proper medical nutrition therapy or any other therapy in terms of diet, exercise and medications. So this is the one of the way where we can assess the patient. It is highly correlated with your hand grip strength. So we can check the skeletal muscle index, which is there on our screen right now. All you need to do is the appendicular lean mass and divide it by height in meters square. You get to know if the person is sarcopenic or no. Second is the visceral fat. Of lately, there are lots of researches coming with the visceral fat. Sir correctly said that there are breast cancers and endometrial cancers which we can see. However, there are 17 types of more cancer which can be solely one of the markers of a visceral fat. So Harvard University has recently coined the term which is known as lipotoxicity, wherein we also see the intramuscular fat and fat is getting deposited at various places. So assessing this visceral fat becomes very essential. Doing it with our conventional ways with the CT scan, MRI scans may not be feasible to do it on our patient on day-to-day basis. However, if we are checking the body composition analysis through BIA technique, we can check it on the weekly basis and we can come to know if the patient is compliant towards it or no. Body fat. We all know body fat is a major culprit of various things, be it the insulin resistance or be it a failure of your cardiac health or various more diseases. So it's very essential to monitor that body fat. Most of us tell, in fact, there were the remission trials for diabetes, wherein we spoke about the weight loss. However, if you focus more on a fat loss, you will enhance the insulin sensitivity. So it's very essential to track that body fat and the visceral fat on regular basis. This is the most classic slide which sir also spoke recently. We identify the person as the visceral fat obese or subacute fat obese, wherein their BMI is normal, but their visceral fat may or may not be the normal. So we know these 4 categories where the BMI is over and where the BMI is normal or under. But there is one more category which we tend to ignore. That is this category, wherein we don't consider the water levels and we don't consider whether their extracellular water or intracellular water is in ratio or no. So the person can be muscular, but his BMI can be high. If the person is having a fluid overload, then also the BMI can be high. So understanding that weight is very crucial, whether it's a water weight, fat weight or the muscle weight. Phase angle. This is the most interesting theory which has coined recently. We call it as the mitochondrial therapy, or we can also call it as understanding the mitochondrial integrity. We call it as a cellular integrity, and this is nothing but your phase angle. It tells us about the immunity system of the patient or their nutritional status. So assessing that on the regular basis can be the important marker to understand whether the person is able to combat this or no. So when the patient is recovering from certain disorders and we check their phase angle, And if we are tracking them from prolonged period, from day one of their hospitalization or day one of their OPD visits, and then we figure out, no, there is a drop of XYZ amount of percentages, and then we implement our treatment or therapy accordingly. So accordingly, we can plan the exercises and diet regime for such individuals along with their medications. C-reactive protein is highly correlated, inversely correlated with the phase angle. So it's very essential if you're checking the C-reactive protein levels, you can correlate with the phase angle. If the C-reactive protein is high, phase angle will be lower. And if the phase angle is high, C-reactive protein will be in the normal range or on the lower side. ECW ratio. So understanding the water balances is very essential in the individual. It can be because of any kind of chronic ailments or because of aging process. So monitoring it. So when we see that the person is visiting us on day-to-day basis or for the follow-ups, we can actually assess their muscle. There are 4 criteria which we can figure out, wherein if the muscles are increasing, or the person is going into fluid overload, or if there is any kind of water retention and person's health is deteriorating to the worst. So we can actually track that with the help of body composition analysis. This is the way we can track. So if the muscles are going down and the water levels are going high, so that means the person is going into fluid overload. Vice versa, the muscle will be improving, so the person is coming out of fluid overload. This is the way the result sheet looks like. And if there was a debate of lately wherein this body composition analysis should be used in the gym, not in the healthcare setup or not in the hospital or clinic setup. However, if we use it in the hospital setup, we come to, and the clinical setup, in the assessment, we come to know the patient is sarcopenic, the patient is into fluid overload, the cellular health is down, lipotoxicity is there, patient is not compliant or compliant towards any kind of regime which has been prescribed. And secondly, the chances of follow-ups, which is a major problem between all of us. So that also improvises. However, if we focus on the gyms or the fitness centers, wherein we can focus on the fat loss of the individual, we can actually prevent the risk of injuries based on their water levels and the phase angle which is there on the result sheet, so that can be interpreted. So if we see both the industries, it is very much essential for the proper assessment. So if we are talking about the health and diseases, so in hospital it is much more crucial to give that patient a better quality of life. So these are the parameters one needs to focus while they are assessing the patients when they are seeing sarcopenia, circulatory disorders, wasting. You can actually calculate the dry weight of the individual when the person visits you on the OPD basis as well. And this can be a practical approach towards the patient. So once the patient walks into your clinic or hospital, there can be a test which will be helping for assessment and screening, followed by a detailed consultation. Then the follow-up where the monitoring continues, and then it can help for improved quality of life. So to sum it up, it is very essential for nutritional assessment. It gives us the brief overview of sarcopenia, fluid retention, visceral fat area and body fat percentages in a zest. It also tells us about the cellular integrity, and it is a non-invasive tool. Thank you.
Thank you, Ankita madam. For we as physicians were unaware that this is such a serious topic, such a vast topic. Now, on behalf of Physicians Association, Sambhaji Nagar, MIT Hospital, Suman Foundation, I thank you all for giving your wonderful Saturday evening, and I urge you all to make the most of this time, which is ideal for merriment, that is Saturday evening. Dr. Suhas Bavikar, please.
Yes, thanks, Mark. So, I would like to thank Dr. Patne sir, who has moderated this CME. His flowery English language has always impressed me. I would like to thank each one of you again for sparing your precious Saturday evening.